I'm Polly Warren and welcome to the Positive Perimenopause podcast. This is the place for some positive inspiration to help you through the rollercoaster ride of perimenopause. I truly believe that with the right support, knowledge and wellness tools, you can feel your best yet, because I'm learning this life phase can be a truly exciting and often pivotal time of life. With every episode, my mission is to support and empower you to own your menopause, because it's time to start taking care of the most important person, and yes, that's you. So thank you for being here and sharing your time with me. Now let's dive in. Hello. Welcome back to the podcast. How you doing? I hope you are really well. I got back from our holiday from Greece last night. We had a fantastic time. It's so good to go and reconnect as a family. I think with 3 teenagers, you spend a lot of the time in different places or ferrying everyone around, and actually it was nearly 2 weeks we had it off together. Spending that time together is so nice. And what was just incredible is that the kids now just seem to get on so much better. My older boys don't seem to take so much delight in winding up their younger sister, which has been the story for quite a few years now. They actually all got on really well. We spent a lot of the time playing volleyball in the pool and going in the sea for beautiful swims. And it was amazing. It was hot there. I mean, goodness, global warming is a thing. It's definitely there. It was on average for the time we were there, it was about between 36 and 38 degrees Celsius. It was super, super hot. And actually, I'm now sitting back home in my office looking out my window. It's raining. It's at least 20 degrees cooler. But I am so grateful that we had the opportunity to go, and I feel totally refueled and ready to put out more of these episodes for you. So that brings me on nicely to this week's episode. In today's episode, I speak to the brilliant Dr. Hannah Short about early menopause, about PMS and endometriosis. Hannah herself has personal experience of all of these. After suffering from debilitating premenstrual symptoms and endometriosis her whole adult life and trying pretty much everything she could to help with the pain, Hannah felt her only option left was to have a surgical menopause at 35 years old. Hannah is a GP and accredited specialist in menopause and premenstrual disorders. She has a keen interest in the role of plant-based nutrition in health, and she lectures widely, providing education and information for both fellow healthcare professionals and also the general public. She is also the co-author of The Complete Guide to POI and Early Menopause, which is an extremely important book for anyone experiencing early menopause and premature ovarian insufficiency. This episode, I think, is a really important episode to really highlight that menopause can happen to anyone at any time. So without further ado, please welcome the absolutely wonderful Dr. Hannah Short. I'm delighted today to have Dr. Hannah Short with me. Hannah, it's really lovely to have you. Thank you so much for joining me today.
Oh no, thank you for inviting me on to the podcast.
I would really like to start by hearing a bit more about you and your experience, because I know when we talk about menopause, we often consider the people we're talking about are in their midlife or they're late, they're past their 40s. But I know that you experienced menopause much younger than this and suffered from premature ovarian insufficiency. So I would love to hear a little bit about your own experience and how that has brought you to the work that you're doing today.
Yeah, well, I don't think I wouldn't have ended up working in the area that I work in now, I guess, without my own experience. When I went to med school, which I did kind of late, because I didn't go to med school till I was 27, I really wanted to do kind of psychiatry, and I started my psychiatry training, and then ended up thinking actually maybe I would help more people if I went back into general practice, which is what I ended up going to do. But it was through my experiences in psychiatry and general practice that I noticed the influence on hormonal health on women's general well-being and health. It wasn't just just their periods. It was every aspect of their health that was affected. And I guess I was more acutely aware of that because I had my own issues. I'd always struggled with PMS, so kind of mood-related symptoms before my periods. I'd always had incredibly painful periods since they started at the age of 13. Never had regular menstrual cycles. I'd often missed time off school, university. When I worked in London, in the city, in my 20s, which is before I went to med school, I actually lost a job because I was an unreliable employee because the symptoms were so severe that I would have to call in sick. And unfortunately, one of the employers that I had was not able to make kind of reasonable adjustments, or not willing to at that point. And so it had a really profound impact on my life. And I wasn't sure I'd be well enough to train as a doctor, which had been a long-term ambition. Um, but yeah, anyway, eventually I went to med school at 27. And that's and my symptoms kind of actually got a bit worse when I was a trainee doctor, and I think it's almost certainly because of the long shifts, the stress, poor sleep, poor nutrition, everything that went with kind of having such a crazy schedule and stuff like that. And yeah, I mean, I'd been diagnosed with endometriosis in my 20s, and that, coupled with the significant premenstrual symptoms, meant that I ended up having a total hysterectomy. So my uterus and my fallopian tubes and ovaries removed when I was 35. And it's a last resort option when other things haven't worked. And I'm happy to tell you other things I tried in the lead up to that. But I was really feeling quite desperate. And so at 35, I found myself in premature surgical menopause, which I suppose in modern terminology is now called surgical premature ovarian insufficiency, or surgical POI. But yeah, so was plunged into an instant menopause. And it was at that point I realised that we don't really, or we certainly didn't manage this very well in younger women. But I was quite quickly saw that it was applied across the board, and there were a lot of women of natural menopause that actually were still struggling, and that's kind of how I ended up doing what I do. I just decided this is what I want to focus on, and saw there was a real need. So
Yeah, thank you so much for sharing that. I think this whole issue of PMS, I mean, the fact that you suffered, you couldn't go to school because of it, must affect so many women, young girls out there. And it's something I don't know what you see in your practice, but I think so many women just believe that that's just part of being a woman and just learn to just get on with it. But it's something which is happening so regularly, and yet it can be so what's the word I'm looking for? Gosh, sorry, my brain is not
debilitating, isn't it?
debilitating. Yeah. That's the word I'm thinking of. I wonder, for you, what did you find anything at that time which was helpful, or what do you recommend now to girls and women who are experiencing PMS?
Well, to be honest, it was more of the pain rather than the PMS that was the issue when I was a teenager. It's just that complicated things. So in terms of the PMS, so premenstrual symptoms, or a premenstrual syndrome, I used to feel quite low and anxious before my periods, but I would often only realise in retrospect I'd feel pretty terrible like a day or so before my period arrived, and suddenly I'd feel quite a lot better apart from the physical symptoms which I then got, but from a mental point of view. It took me several years to kind of realise that was cycling, because I never had a regular cycle. So it wasn't like I was somebody who was on every 28 days that I knew when I was going to happen. It was only afterwards I would realise, or my mum would say, well, I think you're probably going to have your period soon, that kind of thing. But it wasn't, at that point, that wasn't what was the most significant thing. It was just, it was there in the background. It was unpleasant. It was the pain, which was due ultimately, I think, to endometriosis, but that was only diagnosed when I was 22. And the pain was so severe that I would vomit sometimes. I couldn't stand up. I remember waking up in the middle of the night feeling like I'd been kicked in the stomach. And I mean, any pain like that is not normal. So I think, like you say, women and girls they put up with a whole host of symptoms, whether it's directly related to their bleed or in the lead up to the bleed. So we can talk more about the significant premenstrual symptoms that some women can experience, but people just think it's normal or it's just part of being a woman and we have to put up with it.
Yeah.
And so for many years I did. I mean, I did go to the GP, and like lots of girls, I was put on the pill quite a young age before I would have even really needed it for contraception or anything like that to try and control my periods. It did help a bit, definitely, but whenever I kind of had a break from the pill, and it was more traditionally at that time given with the 3 weeks on and the 1 week off, I would still suffer significant pain. It was just that it was a bit more regulated. I had a bit more control over it, I suppose. But when I was younger, I tried various kind of medication, like complementary things as well. I was very interested in aromatherapy when I was growing up, but actually I did have some benefit from using some essential oils, and I did actually train as an aromatherapist back in my 20s, as well as doing my like city work as well at that time, because they had such a profound positive effect on me and actually helped manage to keep things at bay. So there were things I did that helped. I tried nutritional approaches as well, but I didn't really know what I was doing. I bought a book by somebody who'd obviously researched the area, but I think I just I've jumped on this whole thing of cutting out lots of healthy foods as well, and I didn't really feel much benefit, but I think it was probably the stress of trying to do it and not having any guidance. So that wasn't that effective. So yeah, I mean, I tried lots of the medical options like painkillers and pills and things like that, and it was only after I'd been admitted probably to A&E 2 or 3 times I ended up being referred to a gynecologist and had my surgery to diagnose the endometriosis.
Okay.
So
So for those who don't know what endometriosis is, can you just briefly explain what it is? And yeah, how does it show up? It obviously shows up in extreme pain.
yeah, so it's a condition where the cells similar to the lining of the womb are found outside the womb. So they can be found in the pelvis, they can be found on the outside of the womb and on the fallopian tubes and the ovaries, but they can also be found on the bladder, on the bowel. There have been cases where actually endometriosis cells have been found in the lungs or the brain. I mean, they're quite rare, but it's not just confined to the pelvic cavity, although most people it is, I think. So they're cells that are hormonally responsive and they react in the same way as the lining of the womb reacts. So with the hormonal changes, they kind of build up and then they break down and bleed. So as you would do with a period, but obviously if you're bleeding elsewhere, there's nowhere for that blood to go. So it can cause, irritation, inflammation. It can cause adhesions within the pelvis. So, it's very common for women who've got endometriosis to have like the bowel can be stuck to the uterus as well, or some women may be experiencing rectal bleeding whenever they have vaginal bleeding with their period. Some women have coughed up blood during their menstrual menstruation. Um, so it's a pretty horrible kind of
Yeah.
condition.
And is it really mainly due to hormonal imbalances, or is it's not certain?
No, I mean, there's no evidence that it's due to an imbalance. It's not like polycystic ovary syndrome, PCOS, or something like that. So hormone levels are almost always normal if that's
Okay,
occurring in
okay.
isolation. We don't really know what drives it. So there's lots of different theories. There was one theory, it was to do with retrograde menstruation. So where there's some splash back of the kind of menstrual blood back through the fallopian tubes into the pelvis. But that happens in pretty much everybody who menstruates. So it doesn't explain why only 10%, and it's still quite a significant number of people who do experience it, but it doesn't explain why only 10% will develop endometriosis. So there, and also men have been found to develop endometriosis rarely, maybe if they've been inadvertently exposed to estrogen therapy, or women after hysterectomy or menopause can develop it. So that doesn't really explain that theory. But there's a suggestion there may be genetic links, so it can run in families, immune dysfunction. And is it in people who don't develop endometriosis? Is it because their immune system effectively kind of clears up any of the, if there is any
Mm,
splashback blood or anything else like that? Is that what goes on there? So there's lots of different theories, but we don't really have a cause. But I think there's been more and more research done recently thinking there may be something to do with more of the immune side of things. Like, is it a bit more of a, an
yeah.
autoimmune disorder? But We're just not entirely sure at the moment.
Gosh, so you had a lot to contend with at such an early age, whilst training to be a doctor, which, as you say, must have been incredibly stressful in itself. And it sounds like you tried a load of things.
I got some relief from surgery, so I did have several surgeries. I have excision surgery where they cut out some of the endometriosis, and I also had laser surgery. And although that's not generally as effective because it just tends to burn the top of the endometriosis cells, but if they've kind of rooted deep, you can't get to all of the lesions really. I mean, I tried acupuncture. I actually had some benefit from Reiki, which I was not expecting. So it's an energy medicine. But I don't know if that just maybe it's the calming effect it had on me, made me deal with stuff better. I mean, I was incredibly skeptical, but I was pretty desperate. But again, that
Yes.
was kind of short lived. I tried herbal medicine. The one thing I didn't try, which it'd be interesting now, no, I didn't go down the medical menopause route. For the endometriosis, which is where you can have injections or a nasal spray to switch off your ovarian function. I think it was briefly mentioned to me, and I was probably about 23, and I thought, oh no, I don't want that.
Yeah.
But then nobody really offered that again. So
Okay, so you lived with it for quite a number of years before then finally deciding to have a hysterectomy of your uterus, your eggs, your fallopian tubes, the whole lot. That must have been quite a difficult decision, or were you at a point where you just felt like you just needed that relief so desperately? A very quick break to ask you to hit the follow or subscribe button if you haven't already. And if you're enjoying this episode, I'd be super grateful if you could hit those stars and rate it too. Thank you.
yeah, I mean, I had reached the end of my tether, I guess. It had been 22 years, so I started my periods at 13, and I was 35 when I had the surgery. Of things getting progressively worse and just small time, short periods of time where I felt like I got some respite. I felt like I missed out on a lot of my teenage years, a lot of my 20s. You know, I remember going home from parties early because I was in pain, or that kind of thing, missing out on an adventure
Yeah.
holiday because the pain was too significant. Um, but it was the PMS got much worse when I didn't have a routine, and when I was working as a junior doctor, and so as well as the pain, I had a lot of physical premenstrual symptoms. So I'd kind of get incredible breast tenderness, bloating. I'd put on half a stone in weight, and it was just water like retention. I had lots of like sugar cravings, but my mood was really low. I'd just feel pretty hopeless, to be honest, and incredibly anxious. And I've always been an anxious person, but it was particularly bad. I used to get intrusive thoughts that I don't know, I used to wonder have I got OCD because it was just persistent intrusive thoughts, but they were related just in the week or so before my period, and then they'd go. And I remember I did see a therapist at the time because I just thought I've got this chronic anxiety picture, what's going on? And so some weeks I just turn up, I'm like, I'm fine. I don't really, you know what I mean? I just sit there, and then a few weeks later, I'd be in the depths of despair again. I did start tracking it, and realised that there was a link. But again, I was never having regular cycles. Did end up going to see somebody privately because the wait was so long on the NHS at that point. And thankfully, I saw someone who works specifically in this area who did refer me back into the NHS. We talked about other options. I tried the Marina coil with some add back estrogen patches, which is part of the guidelines and things like that. Helped for a little bit, but again, nothing really helped. And I did have a trial at that point of the chemical menopause, but had side effects and had to stop that. And that was the only thing that was left. And it did feel pretty desperate, but there wasn't for me
Yeah.
any other option.
So
So
the PMS then obviously was hormonal, that was going on. And I'm just thinking for anybody listening, if they suffer from PMS, I wonder if you could just tell us, we could just talk a little bit about that in terms of, so you've mentioned some of the symptoms, the common symptoms of PMS, but what is actually the underlying cause? Why are women suffering so badly with PMS and often just before their period?
So yeah, so PMS or premenstrual syndrome is there are about 150 odd symptoms that have been
Yeah, a
linked to
bit,
this.
a bit
Our
like
hormones
menopause.
affect every pretty much receptors throughout the body. So your brain, your heart, your joints, your vagina, your blood, everything is affected. And PMS essentially is an oversensitivity or an abnormal reaction to normal hormonal changes. So again, there's not a hormonal imbalance. It's not about an imbalance. It's about the brain's response to normal hormonal changes. And to some degree, I mean, I think it's normal to experience or be aware of at least subtle changes in your well-being or things as your body shifts. I mean, as women or anybody who's born with ovaries, because it can obviously affect non-binary people and trans men as well. Um, you can be very aware of shifts that happen because we do have fluctuating hormones, and that's how we've evolved. But I think that's so where people might notice, for example, their libido which may be much higher when they ovulate, or their discharge, vaginal discharge will change at different points in the month. They may be slightly hungrier before their period. These aren't necessarily problems, and this isn't that wouldn't come under the PMS umbrella. PMS is when it is affecting, is miserable and you're having, symptoms that are affecting your quality of life. And around 30 to 40% of women and those born with ovaries will be affected. And then there's a much more significant form of PMS called premenstrual dysphoric disorder, or PMDD. And that's where it really the symptoms are so significant that they do affect the ability to function and have a very poor kind of impact on quality of life. So milder PMS can still be very unpleasant, but it may be that certain things can help it. So, things like the right type of contraceptive pill, dietary changes, stress management, herbal supplements. There are things that we can do. PMDD, those things can help, but you may need a bit more help as well, or specialist input. And PMDD essentially is like PMS on steroids. It's like
Yeah.
the worst form. So PMS it can be physical symptoms, so the bloating, the breast tenderness, headaches, things like that, joint aches. Some people feel flu-like symptoms, but also there can be, anxiety, tearfulness, irritability. With PMDD, more of the emphasis is on the psychological and emotional symptoms. So
Yeah.
instead of irritability, it may be just rage, or anxiety could be full-blown panic attacks, or it could be severe intrusive thoughts. Or the hopelessness could be really, really hopeless. And, some women stray into kind of feeling quite suicidal, with 1 in 3 women actively trying to take their own life with
Wow.
PMDD episodes.
Yeah.
So it's really significant. It's not something that's talked about enough.
No,
So
absolutely. Well, one of my guests actually on the podcast, she was talking about it. She had a PMDD, and she believes it's because in her earlier life she experienced some severe trauma, and that really kind of brought it on even more. And she had to do an awful lot of work to get on top of it. And she's got on top of it. She still says she has to really watch herself each month. But I mean,
well, there is an association with PMDD and a history of trauma. So not everybody has to have experienced trauma, and trauma can mean different things. So I think sometimes people will think, well, that automatically means you must have had some form of, awful childhood abuse or something. It doesn't necessarily mean that.
okay.
It could be that you could have had a significant illness. It could have been a bereavement. There's so many things that could come under that trauma umbrella. But what we do know is that people with a history of PMDD tend to have an altered stress response and an altered cortisol response. And so there have been quite a few studies looking at that. And certainly it does seem to be something that would trigger it if you've got a genetic susceptibility, because we know that there are genes that would make you more likely to develop PMDD, like there are for lots of conditions. I mean, it's like with type 2
Yeah.
diabetes, you could have the genes which predispose you to that. But if you don't have the environment that's likely to trigger it, say maybe you're lucky enough to be born into a family that's educated about health, has enough money to kind of buy good food, and is interested in exercise, you may not never develop type 2 diabetes. But again, if you don't have access to things like that, or access to the education, then you're much more likely to have those genes switched on and develop this condition.
So you had your hysterectomy. When you went into that, were you, I mean, I suppose, I mean, I don't know if being a doctor or training to be a doctor, that was helpful or not. did you go into that feeling well prepared, knowing exactly what was going to happen? And how did you feel afterwards? Did you have a plan in place to support that suddenly having no hormones being produced in your body?
Yeah, I mean, I felt I think it, I mean I think it was an advantage being a medic in that I kind of knew how to find the person to be referred to, which is what I did. Obviously, I kind of looked, I researched it, and obviously I was lucky that I could afford to have a private referral initially, and ultimately I was lucky because I was then referred back into the NHS because I met the criteria. But so I was lucky, but I'd done my homework and I knew who I kind of wanted to see, so that was good. And I know that the consultant gynecologist I was under, he's very empathetic, he's knowledgeable. So I thought from that point of view, I felt, as well prepared as I could be. I understood what the surgery, I understood the benefits, the potential risks of it. And I was prepared to go ahead with that. But I wasn't really prepared for the reality. Like the plan was obviously to have the surgery. I knew that meant I'd go into a premature surgical menopause, but for me at that point, I was like, well, anything is better than existing the way I have been. So, um, but I naively thought it would be quite simple in terms of just need to get my hormones right after the surgery, and I'll just go on my way. I just need a bit of estrogen, and I'll be fine because it's important to replace estrogen if you go to an early menopause, unless you've got something like a history of breast cancer. And obviously, there are cases where it might be slightly different. But for most women, if you have an early menopause or you have POI, estrogen is important for your bones and your heart and brain health. So I think naively, I thought, well, maybe it'll just be like being a woman who never had these issues. I'll be kind of my ovaries aren't there to kind of wreak havoc. I just give myself some estrogen and go on the way. And it wasn't anything like that. So it was a bit
Yeah.
of a shock.
So the fact that you kind of knew that you needed some estrogen, because I do hear stories again and again of women who go in and have a surgical menopause and actually aren't informed, they
Mm.
haven't got that information that actually they do need to replace that estrogen for their long-term health. Is that, I mean, I'm hoping that is now changing and people are becoming more informed, but for many years I know that wasn't the case.
Well, I mean, to be honest, it's horrifying because it still happens quite a
Yeah.
lot, and it shouldn't do. But really, it should be the surgeon should not be doing the operation without discussing that with the patient, because it's so key. I mean, I had a patient recently who was really, she'd recently had surgery for PMDD and was actually feeling really good after surgery and was on some form of HRT, but she hadn't actually been told about the risks associated with an early menopause. And I just thought, well, how can that happen? How can a young woman go through the surgery and not have been told about what this means and weigh up, is it still the right thing for her? And obviously you don't know 100%, but you can't make a fully informed decision without that.
Yeah.
So I think it's negligent if it's not discussed with patients. Um, I mean, there is I mean, sometimes, and I've seen this from both sides, sometimes people are told stuff, but they don't remember it, or it's not been explained clearly enough. And I mean, I myself, I think when I was in a particularly bad place before my surgery, my husband, who rarely comes with me to medical appointments, did come, thankfully, on this occasion. And I think I came out and I said, well, he didn't say this or he didn't say that. He goes, yes, he did. He clearly stated this. I can't remember what it was about now, but I remember it just made me think, oh, okay. So we're all just with the same. Well, whether we're a doctor or not, when we're a patient, we're just the same. We're human beings who are
Yeah.
scared, and
Yeah.
you have a million things going on. You probably don't take everything in, and it is hard. But I think there are definitely cases where people are just not told, and it isn't simply that they've forgotten. I think it's similar to when gynecologists used to just take women's ovaries out just because, oh, they may as well. They probably don't need any more babies, or that kind of
Yeah.
thing, which still happens, but not as much, thankfully,
Yeah.
because we shouldn't be doing that.
Yeah, God, no. So those risks those longer term issues such as your bone health, your heart health, your brain health. Are there any other risks associated with
Well, I mean, obviously, there's
hysterectomy?
a risk with any surgery.
Yeah, yeah,
In terms, so you've got the physical surgical risks, and there are. I mean, I do know people who've had long-standing, say, bladder issues because nerves have been damaged and things like that. There's risks. So yeah, brain health. I mean, there's association with early Parkinson's, onset Parkinson's disease, which isn't fully taken away with the use of HRT, for example. I mean, I didn't know about this. It's the kind of thing that I sort of think, oh, but then I think, well, I can't really change things
Yeah.
now. So there are, if things are, if we don't manage patients properly, if or give patients and women the information stuff to make good decisions, we increase the risk of things like the type 2 diabetes and other things like that as well. So there's effects on the whole system.
So let's go back to post your surgery. So you said that actually you were not ready for what came next. Tell us a little bit about how you felt and what did happen to you.
I mean, I was lucky. I was able to take some time off work, and I did. I was given HRT. One of my issues was that I didn't absorb the HRT I was given, and I hadn't even anticipated that would be a problem. So I was given some estrogen gel, and I just felt terrible. I mean, for the first day or so after surgery, I was fine. I mean, I was generally okay, obviously, but I did use I had weight like hot flushes, and initially I was just, well, this is just, it's obviously the body's had a bit of shock. Maybe this is to be expected, but. And I kind of was up and down for a few weeks, but I've progressively got more and more tired, whereas I felt like I should have been getting better. I should have been recovering, and my joints started to really ache. I was getting terrible headaches. I couldn't sleep. And so I had my hormone levels checked and they were pretty low. I may as well have not been taking anything. So I spoke to my consultant. We changed the HRT, but the long and short of it was I just never absorbed anything well through the skin. And there's around 20 to 30% of women who are the same. I tried having tablet therapy, but the level I needed at that age, it triggered migraines. So I ended up going down the HRT implant route, which isn't that commonly used now. So I was able to get this on the NHS, but there's very few places that do it. And I actually had to stop getting it on the NHS a few years ago myself, just because the clinics were constantly cancelled and things like that. But anyway, so it's a small pellet that's inserted into the skin, generally around the buttock, and releases estrogen that way. And it's not perfect, and you can't control the levels, but it did actually get me to above baseline, and I started to feel better. And so that was part of it. When I finally got some estrogen in my system, things did start to settle. That was several months after surgery, but I then had to take some time off work. So I'd gone back to work probably about 3 months after the surgery. I mean, I took a fair amount of time off because I was supposed to be in a really busy medical job, and I just thought I can't
Yeah.
do this if I'm not feeling well. And then I went back, but I'd never had any replacement testosterone. And obviously, over 50% of my testosterone had gone with my ovaries as well. I just had really profound fatigue again. I couldn't think straight. I remember being on the medical ward, and somebody asked me something that I should have known, and I just froze. I couldn't think what was. I thought, I don't really feel like I'm safe to be here. And then I ended up having to take another 6 weeks off work because I just felt I'm not safe to be on a ward. Like, I can't make safe medical decisions, and I was so worried that it meant that I hadn't got a career ahead of me, that I
Yeah.
wasn't going to be able to do that. But I had some testosterone placement again via implant, and that made a big difference to me. So that was probably about a year into surgical menopause, and I started to feel like I was getting better. But it was a bit of a long road. It's been 10 years now, and it has been a long old road, but I'm a lot better than I was a few years ago. So
Oh, well, I'm so pleased to hear that because goodness, you've really, yeah, you've had it all thrown at you. What I'm really interested to hear about is the lifestyle changes that you've made and the effect that they've had on you. Because I'm particularly looking through your book, there's such a big section about diet and movement and managing our stress and all those things. So I'd love to hear how you kind of worked that out for you and how it's helped you to feel more like yourself today, because today you look great, you look radiant and healthy, and yes, so it's obviously working.
Well, I think for years, well, probably for the first 3 or 4 years at least, anytime I didn't feel great, I'd be like, oh, my HRT is not right. And I was slightly obsessed, I think, with getting hormone levels checked and stuff. But then I started to realize that it didn't always add up. So sometimes it was very obvious that my implant had run out or early, or, something that, I did need some more HRT. But sometimes my levels would be fine. And I'd be like, but I feel terrible. and it was at that point I started looking a bit more at lifestyle and stuff. And I've always been interested, I suppose, in kind of eating relatively well, staying healthy and exercising. A lot of that had been difficult for me pre-surgery because I don't know, for example, I was not able to run or do all the stuff I wanted to do with my pain, and my mood changes affected how well I was able to kind of do certain things as well. Um, so I started training to run again. I used to, because I'd always loved running in my early 20s until my pain got too much and I just stopped eventually. So I did couch to 5K, and I actually found that running gave me more energy than I thought, because for so many years I felt so tired, but actually building gradual movement into my day made a big difference. And I think there's a balance. You don't want to be kind of doing ultra marathons and stuff all the time, but just doing something
Yeah,
made a big difference.
I totally agree. It kind of movement feeds energy. It's just getting yourself going, but it's just starting, isn't it, to get that energy moving and circulating around your body, and it fuels you to feel so much better.
So, I mean, I think running made a huge difference to me, and I'm just doing. I mean, it wasn't like I was ever a brilliant runner. Sadly, I'm injured at the moment. I haven't been able to run for the past year, which has been so
Oh
depressing. But
no.
I'm hopefully getting there again. But running, I think, just gave me that energy, and it really helped my mood, and things like that. So, but also I've started doing quite a lot of yoga. I used to do bar, where you'd kind of do, I suppose, like Pilates or ballet type exercises at a ballet bar, but it was developing strength and stuff because that's an important consideration as well.
Mm-hmm.
Surgical menopause and all menopause. And I think that just gave me a bit more confidence again. And I felt like it was a miracle drug, really, exercise in that point of view. I noticed that alcohol didn't agree with me very quite quickly. I mean, it's never really agreed with me, to be honest, but it definitely, after surgical menopause, wine and me don't mix. I mean, I've tried over the years, but it's just it's and I the more research I've done and the more things I see in clinic, I think something changes after menopause. I think for a lot of women, in that their body is not able to metabolize alcohol in the same way, and certainly if you're taking HRT, I think it highlights the effects of alcohol, and alcohol drives more hormonal fluctuations. So, I mean, like I said, I was never somebody who drank a lot by some people's standards anyway. But one drink would be enough. But to be honest, I barely drink alcohol these days because I just feel better in terms of
Yeah.
I'm going to sleep better. And yeah, I just generally feel better. My mood's better. I mean, eating wise, I suppose as a junior doctor, it was very difficult because my shifts were terrible and there was
It's
never
so
anything
ironic,
healthy to
isn't
eat in the
it?
hospital.
It's ridiculous, isn't
Uh,
it?
you go and make yourself something healthy to take on a night shift, and then you'd leave it in the doctor's mess, and then never have time to go back and get something healthy. And then there were only vending machines with like Mars bars and stuff, and so that wasn't great. But luckily, I was coming to the end of my training, or just soon after the surgery, and at least I was in GP for a few of the last couple of years, so I was able to maintain a bit more structure in that sense. But I realised again, if I ate badly, I felt worse. And one thing that really forced me to look at my diet was that I became vegan for kind of ethical and environmental reasons. Gosh, 7, 8 years ago now. And I thought, well, if I'm going to do this properly, I need to do it healthily as well. I mean, you can be a vegan and you can live on fries, and it's not going to be a healthy diet. So um, I started looking at that. So I quickly realised that having more whole foods in my diet made a massive difference to my kind of energy, my skin, because that's one thing I didn't. I developed horrible skin things like rosacea and various other things straight after the surgery as well. Everything kind of seemed to improve when I had lots more fruits and vegetables and legumes and nuts and seeds, and a lot more soya in my diet because the phytoestrogens seem to, I don't know. I mean, they seem to improve things for me, and I know there's evidence they improve your gut health, may even improve how your body responds to HRT. So I think it was just trial and error, and realizing, and it's not that I don't ever enjoy. I mean, I had chocolate this morning. I mean, it's not that I don't ever eat kind of treat foods or whatever, but it's just I quite frequently eat them. But my main part of my diet, I suppose, is the whole foods side of things, and that's made a big difference.
Do you find that it's easy to get enough protein for yourself? Because I always get that question from people. I just worry if I go plant-based, I'm just not getting enough protein in.
Yeah, I mean, to be honest, I know everyone always says this, if you have a plant-based diet, and then they'll say, well, where do you get your protein? But I think there's a lot of people who don't follow a fully plant-based diet who still have they have inadequate protein, or they have not very healthy sort of forms of protein. So maybe they'll be having sausages and bacon, for example, processed red meats that we know are carcinogenic, and so to be honest, I don't think I had a particularly brilliant diet beforehand. I always liked vegetables and things like that, but I would often have a dairy milk and cheese sandwich. It was a very like as a lunch. That it was it wasn't it was a not a healthy or nutritious diet. I was probably a little bit of calcium in there, but it was pretty beige, little fibre. My protein, yeah, I have quite a lot of. I suppose I do. I like tofu and tempeh, but I will have edamame beans in kind of salads and stuff. I sometimes have some seitan. It's not something I make myself, but we'll have it in certain things. I have lots of different pulses. I have quite a lot of peanuts and peanut butter. I do sometimes have some protein powder when I make up some smoothies and things like that from a good quality source. And I think I probably actually consume more protein than I used to, because I've never loved somebody who had meat for breakfast, lunch, and dinner or anything like that. I probably didn't really like it that much a lot of the time. I would often opt for a vegetarian option anyway. So I think my diet's definitely improved. I think it's like all diets require planning, don't they?
Yes,
And I think
exactly.
people don't seem to talk to people who don't have a plant-based diet about, are you getting enough fiber? Where are your
Yeah,
micronutrients? And a lot of
absolutely.
people are deficient in that. So I will often ask patients about their diet, and sometimes people don't seem to have any vegetables apart from when it's a Sunday, when they might have Sunday lunch.
Yeah,
So they might have spaghetti bolognese and a pizza and a chicken curry, and you think, yeah, there might be some tomato and onions in the sauces that they've got, but there's no greens. Then,
yeah. As we know, those phytoestrogens are so
yeah,
good for us as we go through menopause. Correct me if I'm wrong, but there is research that suggests that they help with that hormone balance, particularly with estrogens.
yeah. So they can help. So basically, they can affect the cells, the gut microbiome. So you've got the bacteria and everything in your gut, and you can also get more advantage from taking in other kind of plant-based foods, and that can affect on how well your body deals with estrogen as well. So, and actually, whether it's not the phytoestrogens, but generally a plant-based diet, you tend to have. I don't know. I tend to steer away from the word balance because it doesn't really mean that much sometimes in the medical context, but in terms of breakdown products of estrogen, women who have more of a plant-based diet tend to excrete more of the breakdown products more effectively than if you have a diet that's very rich in processed foods or kind of meat and dairy heavy. So people who have a kind of a meat or processed food heavy diet will often have higher levels of beta glucuronidase. It's an enzyme in the gut that reactivates the breakdown products of estrogen, and you reabsorb it into the gut. That
Yeah.
tends not to happen if you're having more of a plant-based, fiber-rich diet, particularly if it's rich in phytoestrogens. And I think some people are like, well, if you're reabsorbing it, surely that's a good thing if you're kind of low in estrogen. But this is the part that your body wants to get rid of, and actually it just contributes to hormonal fluctuation. It doesn't improve symptom control, and actually you get more balance if you in terms of your levels. You're not going to have these ups and downs if you have a more of a fiber rich diet. So it's really important from that point of view. I mean, there is more work coming out in this area, but just talking about things that you less likely to have side effects from certain medications with this fiber-rich diet, including HRT, and you're less likely to develop estrogen-dependent cancers potentially. I mean, we need more definitive research, but it's an interesting area, and
Yeah.
certainly the British Menopause Society last year, they were talking about we should be advocating for a 95% plant-based diet, because the evidence shows that's what's most beneficial for menopausal symptoms and long-term health, because it's an anti-inflammatory way of eating, and yeah, decreases the long-term risks of certain conditions that are quite inflammatory in nature.
Thank you. Yeah, I mean, it's a minefield, isn't it? Because we're told so many different conflicting information about what we should and shouldn't be eating. But yeah, I mean, it all makes perfect sense to me that yeah, the more plants we eat, the better it is going to be for all of
I
us.
think it can. I think it can be overcomplicated, and I think you could spend hours talking about the different bits. But essentially, I think the key thing is just more plants is better.
Yeah, yeah.
And although, from my personal point of view, I'd love it if the whole world went vegan. But from a professional point of view, really, what I want is for people just to add more plants to their diet because of the benefits that's going to give them. So they don't have to go completely vegetarian or vegan. It's about increasing the fibre, the micronutrients, the anti-inflammatory dietary profile, and if they do choose to consume animal products, just maybe have smaller amounts,
Yeah.
and think of it as more as a garnish. So a bit like some of the Southeast Asian countries, and where we tend to see, lower rates of issues relating to kind of osteoporosis or and menopausal symptoms and things like that as well. So.
Yeah, it's variety, isn't it? It's eating a wide variety of plants rather than just eating the same old vegetables every single day. It's kind of trying to eat as many as possible.
Trying to aim for 30 different
Yeah,
plant-based foods a week. And it sounds like an awful lot, but actually you can do it relatively easily. So that includes things like nuts and seeds. So if you had, say, a porridge with soya milk for breakfast and you had some frozen berries and you add on a couple of seeds, you've already covered quite a few there.
yeah,
And even, if in your sandwich, just add in, I don't know, add in a radish with your lettuce and, whatever you're choosing to have as your sandwich base. You
yeah,
could
exactly.
have seeded
Herbs,
bread. Yeah.
herbs as well. Things like pestos are always really good, aren't they? You can chuck in a load of there of
Exactly,
herbs
all of
in
that
there.
stuff.
Yeah,
And
exactly.
curries, just chuck in some extra, chuck in some peas or some chickpeas or, an extra thing. I think I always say just like eat the rainbow, eat the alphabet. So you just want to just cover the entire spectrum.
And then my final question, which I ask all my guests, because this is called the Positive Perimenopause Podcast, I like to give the listeners one practical, actionable takeaway tip, really, which they can put into practice straight away to help them have a more positive perimenopause. Is there something that you could recommend for them to do?
I think for women who've gone through an early menopause or a POI, I think everything can feel overwhelming. So I know we haven't had time to explore a lot of the psychological impact of that because that can be immense and maybe one of the worst things for people.
Because in your book, sorry to interrupt, you do have a couple of really fantastic chapters. And by the way, I'll put the link to this in the show notes. You have a chapter on fertility, you have a chapter on living positively child-free, a chapter on self-identity, which are all really, as you say, really, I can imagine can really affect women very deeply. So yeah, sorry, carry on.
No, because I think one thing that's, I say, positive, I suppose, is to that you almost kind of get it can be a very confronting diagnosis, especially if you're given POIs and it's not a result of surgery, because at least I had that knowledge that was coming up. I think it's you take it as a kind of an opportunity to kind of future-proof your health, and it can it's very, very difficult, but I think I'd say surround yourself with or connect with other like-minded people or people who've been through a similar experience, and it will depend on that group is going to depend on where you are in that kind of journey, for want of a better word. So there's the Daisy Network, which is a good charity for looking at women who've POI diagnosis. So if you're diagnosed under the age of 40, but it may be that you would actually feel more comfortable connecting with women who kind of find themselves without children and having a bit more of a focus on the positives of that, or how you can kind of move forward with that. Or I think it's just thinking, what can you kind of take from this? And often the positive thing is like making new connections. And I wouldn't have ended up in the work where I am now. I wouldn't have made the positive connections I've made. I'm realizing now I'm 45, but over the last 10 years, I've managed to make lots of changes that I might not have considered ever making until I was 10 years down the line. Whereas I think a lot of my peers are going to be going through the stuff I've gone through now in, 5, 10 years time, and think, well, actually, I don't have to worry about that in the same way because I've already put these things in place. And I don't know if that's a positive way to think of it, but I do think it can be quite empowering in a way. Yeah, yes, you confronted with this difficult situation that through no real choice of your own. But there can be positive things that come out of it. You can make meaningful changes, meaningful connections. So I think it's just, connecting with others is the main thing, and knowing that there can be some positives that come with it as well.
Yeah, thank you. It's like anything, isn't it? It's how we choose to perceive the situation. You could choose to dwell on all the things that you've lost but actually you can also choose to look at all the things that you have gained and the path that it's taken you on. And now you're helping so many others through with this, through your own experience, to be a doctor and to have lived experience of it is just so valuable. So thank you for all that you do. And it's been such a pleasure talking to you today.
Oh, thank you.
Oh, Hannah, before we go, what I didn't ask you to do is if anybody wants to buy your book, or if anybody would like to get in touch with you, or tell us how they can find you.
Well, I have a website and it's just short.co.uk. I am on Twitter, but I do tweet about all kinds of stuff. It's not just menopause. And yeah, I suppose Twitter's probably social media is probably the thing I use the most. I have got Instagram, but I don't tend to use it because it's that much professionally. That might change. It's just literally just finding time in the day to do these things, really. But lots of my stuff, I'm hoping to start writing a blog, which is on my website, because I do enjoy writing, and I think there are so many things still within the space of hormonal health that I want to explore, that I'd like to kind of write from a personal point of view, but also talk about practical tips that people can, take away and direct to other resources that I find helpful as well. So in the coming months, my plan is to write some blogs. So
Amazing. Thank you so much. Thank you.
Thank you, Polly.
I have put all of Hannah's details in the show notes, plus there are links for some of the issues that we've talked about today. Here are today's highlights. Number 1, endometriosis is when cells, which react in the same way as the lining of the uterus react, are found outside the uterus, on the fallopian tubes, on the ovaries, on the bladder, on the bowel, or in other parts of the body. Number 2, over 30 to 40% of women are affected by PMS, of which 150 symptoms have been linked. Number 3, PMS is an oversensitivity or abnormal reaction to normal hormonal changes. It's normal to be aware of shifts in hormones, but PMS is when symptoms are affecting your quality of life. Number 4, things that can help PMS are dietary changes, the right kind of contraceptive pill, stress management, and herbal supplements. Number 5, PMDD, otherwise known as premenstrual dysphoric disorder, is like PMS on steroids when the symptoms are so severe that they affect the ability to function. 1 in 3 women actively try and take their own life with PMDD episodes. So if you feel like this might be you, then please go and seek help. You might need some more specialist help to help manage this. Number 6, having your ovaries removed during a hysterectomy means you'll be put into menopause. It's recommended that you replace your hormones with HRT, and it's something that you must discuss beforehand with your specialist. Number 7, a little reminder, because as we know, movement fuels energy and it's good for your mood too, as well as a whole host of other benefits. Number 8, phytoestrogens can improve your gut health and how your body responds to HRT. Number 9, another little reminder, eat more plants and whole foods. Women who have more of a plant-based diet tend to excrete more of the breakdown products more effectively than if you have a diet rich in processed foods or meat and dairy. This helps balance hormone levels. You're less likely also to have side effects from medications, including HRT. And number 10, connect and surround yourself with people who've been through what you're going through or are going through it. It can really help. Thank you so much. If you're still listening, if you've got to this far, thank you. I am so grateful for your ears. I hope you found this episode helpful. I hope you found it useful and that there's something that you can take from it. If you have enjoyed this episode, or any other episode for that matter, then please do feel free to leave a review. It really helps. Or just simply subscribe to this podcast on whatever platform you listen to your podcasts. Thank you so much again for listening. Have a really wonderful week. I know that you're doing the best that you can. Remember, you are awesome, and I look forward to speaking to you next time. Take loads of care. Bye.